Hello everyone, my name is Alan McKiernan from Prior PLM Medical based in Ireland. Prior PLM Medical is a research, design and development company that specialises in drug delivery systems, respiratory devices and injectables. I want to thank DDL for giving me the opportunity to speak and to share some results of our recent experiments looking at inhaler dose release. Concern has risen in recent years regarding the global warming potential of pMDI devices, and the finger has been pointed at the propellant, typically HFA134A. Switching to DPIs has been proposed as an alternative. However, while this is estimated to substantially reduce greenhouse gas emissions, other environmental impacts increase, and DPIs aren't always suitable from a clinical perspective. So industry is looking at switching inhaler propellants to greener alternatives. New propellants may have different properties, and so their effect on the dose delivery mechanics and fluid dynamics needs to be studied. Some alternative propellants have been identified, and one of these is HFA152A. Here we've used two imaging techniques to compare the newer HFA152A to the older HFA134A workhorse. Imaging based on X-ray absorption contrast has been in use for well over a century. High-speed X-ray imaging needs lots of photons and is often performed at a synchrotron. A synchrotron is a sports stadium-sized particle accelerator where electrons moving at close to light speed emit intense X-rays. In recent decades, powerful synchrotron sources have become available with properties capable of enabling X-ray phase contrast imaging. This technique is sensitive to refractive index differences, making it quite useful for imaging low atomic number materials where absorption contrast is low. So HFA152A is a promising candidate to replace current propellants, and from manufacturer data here on the left, we can see that while the physical properties are similar, the newer propellant has a lower vapor pressure and a substantially lower molecular weight. If we look at high-speed video of each propellant in the same off-the-shelf actuator, we can see that in both cases the typical pattern takes place of flash boiling driving material out of the orifice and generating large jets and droplets. We also see liquid film growth and decay in the conical bowl region. So the behaviour is quite similar in both cases. Here we compare stills taken from video of each propellant in three commercial actuators at the same time point after dose commencement, with HFA134A on the top row and HFA152A below it. Again, we see broadly similar behaviour. For example, we can see a similar spread of large and small bubble sizes and liquid present in the sump. These devices contain 100% propellant, but the addition of ethanol is known to change the bubble size distribution towards more smaller bubbles, something that can be of relevance for some product formulations. In many of the images shown, liquid jets are visible exiting the orifice. From the high-speed X-ray video, we can obtain the length of time during which boiling liquid is present in the actuator and compare across both propellants in the three actuators studied. As expected, the devices with larger orifice diameters tend to empty a little quicker. With respect to propellant, the HFA152A boils a little quicker than HFA134A. We have also looked at what is happening in the orifice channel. Here we can see three stages. Firstly, dense jets and streams in and exiting the channel. Secondly, we can see boiling turbulent material entering the channel and flowing along the edges. Thirdly, we see a thicker flow along the channel with rapid variations or pulses. Folks who have carried out modelling have hypothesized that there may be an annular film flowing along the channel walls with clouds of small droplets in the channel. This video may support that, but we're hoping to look at this in more detail in the coming year. From the high-speed X-ray video of the orifice channels, we can also obtain the times during which liquid is present in the channel and liquid jets are emitted, and compare across both propellants in the three actuators studied. Liquid droplets and jets are typically present while liquid is fed through the orifice channel, but are also made up by some of the cool external liquid films seen outside the orifice that we mentioned earlier. Also displayed are the duration of high-density plume captured with the Schlieren technique. These times are a little shorter than the timings from X-ray footage, but are recorded outside the mouthpiece so that some droplet evaporation may have taken place in transit, thus reducing the plume high-density duration observed. Schlieren imaging is an optical method that is sensitive to the refractive index gradient of visible light. Essentially, a region with a refractive index gradient causes the light beam passing through it to deviate slightly, and this is captured by a high-speed camera. Video post-processing can be performed where the same line of pixels from each successive frame is stacked side by side, leading to a position versus time plot or kymograph. This can be seen where the top two panels show a plume at two different times recorded with the Schlieren technique, and with a white line depicting the line of pixels extracted to generate the kymograph. The bottom panel shows the kymograph plot where the x-axis is time and the y-axis is the distance along the line of pixels. The white lines are also marked on the chymo below as dotted lines. Schlieren detected density gradients occurring between the mouthpiece and leading edge are vertically below the leading edge in the chymo, and later times are to the right. The same technique was also used to generate position and timing data from X-ray videos. The chymo technique has the effect of compressing a video sequence into a 2D image along a particular direction in space, which can be quite useful. So we've used this technique to obtain the spray leading edge velocity and spray cone angles. The spray velocities for both propellants follow similar patterns of decay with distance, and at longer distances from the mouthpiece, the HFA 152A plumes are the same or maybe slightly faster. The plume's spray cone angles were measured at 120 millimeters from the mouthpiece and are similar between the propellants in the same actuator. In conclusion, while there are property differences between HFA 152A and HFA 134A, X-ray phase contrast imaging of placebo HFA 152A and placebo HFA 134A show similar behavior. In the sump, boiling completes marginally faster with HFA 152A. Also, liquid periods in the orifice channel are marginally faster with HFA 152A again. And Schlieren video of HFA 152A and HFA 134A spray plumes also show similar behavior. While the two propellants behave broadly similar in the actuator, the effect of minor differences may become more evident as the formulation becomes more complex and interacts with the device components and materials. So thank you very much for watching and listening to this presentation.